Idaho Matters podcast is brought to you by St. Luke's On Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on demand care for common ailments such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org. From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Every time you take a drink of water or flush your toilet, that water has to come from somewhere. Here in Idaho, there are 450 different systems to take care of wastewater, and there are more than 2,000 different systems that bring safe drinking water to thousands of homes across our state. Now, many of those treatment plants are old, and they're falling apart. They need to be replaced or repaired, and the need for more reliable systems is growing as the population of our state just keeps expanding. So, how bad is the problem, and how bad will it get, and how much will it cost to fix it? A new policy brief from the James A. and Louise McClure Center for Public Policy Research at the University of Idaho takes a deep dive into this issue, and the report's lead author, Liz Bagent, is here to tell us about it. Liz, nice to have you on the program.
Thank you. It's great to be here. Thank you for having me.
Good. Absolutely. So, Liz, let's start with this. How many of these types of systems are in Idaho?
So we have just over 2,000 drinking water systems. It was 2016 as of earlier this year, and most of these are quite small, and then about 450 wastewater treatment systems, a large portion of which are also quite small.
And Liz, are we talking just domestic systems in those numbers?
Yeah, this excludes industrial systems like you might see at like the Chobani factory or these other sort of industrial uses.
And there are three big systems in the state, and we're looking at places like Boise, Meridian, and Nampa. But what about the rest of the state? Are most of the rest of the wastewater systems fairly small when you compare them to those three major ones in the Treasure Valley?
Yeah, so we have better data on drinking water systems than wastewater systems. And 97% of drinking water systems in Idaho serve fewer than 3,300 people, which happens to be the definition of small. And on the wastewater side, we think about half serve less than 3,300, possibly more, but the data isn't as clear there.
And my understanding is that you wanted to know what our future needs look like. So you came up with some estimates. So can we start with wastewater? How much would it cost to meet the current infrastructure needs this year as well as next year?
Yeah, so for wastewater needs in fiscal year 2025, we estimated about 617 million. And then in 2026, I think it's about 730 million, though that's a bit of a provisional estimate because we don't have the full data for 2026.
So let me ask you the same question for drinking water then. How much would it cost to meet that current infrastructure need this year as well as next?
Yeah, so for fiscal 2025 on the drinking water side, we have $369 million in needs in fiscal 2025, and then 335 at least for fiscal 2026.
So that seems like a lot of money. So can we talk about why the needs are so high? Can we begin with growth? It seems that this is very high on both lists. So talk about that and maybe to give people an understanding of how much our population has grown.
Yeah, so the more people and homes and businesses we have in the state, the more we need wastewater and drinking water infrastructure and services to support them. And Idaho has been in a really strong period of growth in the last few years. I think your audience is probably quite aware of this. Everyone has been feeling it. Between 2000 and 2024, Idaho's population grew by 700,000 people. That's 54%. So we went from 1.3 million to 2 million people, and we're expected to continue growing.
And you can feel that, as you said, Liz. Right? I mean, in driving, you can see it. I mean, there's so much more traffic. We can name so many things that we see every day that for those of us who are either from here or I moved here in 1999, you can definitely feel that growth. But my question is, Do people necessarily feel the growth when we're talking about drinking water and wastewater? Because yeah, we use it every day, but it's not something where I'm thinking, gosh, do we have enough, drinking water?
Yeah. So I think a lot of infrastructure is sort of taken for granted. We just sort of use it and assume that it will always be there. And wastewater and drinking water systems are literally underground. A lot of that infrastructure you cannot see. So it's pretty easy for this to fall off the radar until maybe there's a disruption in services, or in order to finance the cost of an improvement, your rates have to go up, and then people really feel the um, impact of our aging
Hmm.
and challenged infrastructure.
So we know population has grown exponentially. How about housing units? I'm assuming we've seen a lot of, I mean, of course, we've seen a lot of growth in that.
Yeah, so generally housing and construction have increased as Idaho has grown. Whether that's kept up with population is a topic for a different show, I think, but
Hmm.
but we're seeing increases in the number of structures being built in the state. Um, and about 65% of new homes in Idaho are connected to wastewater systems, and 77% are connected to drinking water systems. So that's a majority of these newly constructed homes, but not all of them. And just to be clear, other homes are served by septic systems and wells. It's not like they have no services at all. But these new
Hmm.
connections to the public systems incur costs. Sometimes those costs can be covered by things like connection fees, depending on the situation, but sometimes they're not.
Okay, but that also I would think then impacts the systems themselves, right? When you have something like um, you know, housing units more than double, then they're also using those systems and adding strain. Is that a correct assessment?
Yeah, I think that the sort of capacity of a system, there's a fixed number of people that it can serve unless efficiencies are gained through sort of upgrades or changes to the system. I would say that the people who are running these systems, when they plan a large infrastructure upgrade, they try to take into account future population growth to the extent that they can.
Mm.
But one of the challenges in Idaho is that we expected Idaho to grow over the last 20 years, but maybe not quite as much as it did.
And there are other factors at play as well, we should note. Along with old systems needing repair or replacement, regulations are also a driving factor. So, how do better regulations play into all of this?
This is a great question. So, these systems are subject to rules that the objective of these rules is to protect human health and the environment. So, these rules change over time as we learn more about what might be harmful to human health or harmful to the environment. And when the rules change, this often means that systems need to be adapted or upgraded to meet the new standards. And this can cost a lot of money.
There's another issue as well, Liz. Just like with doctors, these plant operators are aging out, and there just aren't enough people to replace them. So, w- how bad or dire is that issue?
Yeah, so there's a lot of discussion sort of in the wastewater and drinking water sector about their aging workforce. So we tried to look at the data about the age of the folks who are working in these jobs, and the data isn't complete, um, but we see some patterns that are prevalent across a lot of sectors because the population of the U.S. is aging, the population of Idaho is aging. And in the wastewater and drinking water sector, you can see that there's a decent portion of folks who are nearing retirement, but there's also a pretty strong pipeline of people in sort of the mid range of their career who can fill some of those gaps. What we need to look out for are the younger folks coming into the industry because, people get older and they do retire eventually. And one of the ways that this is being addressed in Idaho is through a registered apprenticeship program that has been running for about 5 or 6 years. And it's been really successful. Enrollment increases every year. And I think we're starting to put these jobs on the radar for people who want to use their talents sort of to serve their community in this way that might be not top of mind.
So I want to talk about solutions next because paying for these systems comes from taxes and fees or even federal funding. And in the past, this has helped Idaho. especially when we look at plans like the American Rescue Plan and the Jobs Act. But Liz, what happens now because those funds are gone?
Yeah, so the financing for these systems has historically depended on some federal funding streams that flow through the Department of Environmental Quality. That's a state agency that runs our state revolving fund. This fund offers low cost loans that allow municipalities and water and sewer districts and whoever else is running these systems to finance their projects. And even prior to changes in the federal funding landscape, this state revolving fund was not able to keep up with the demand for their loans. And so we're really facing a pretty big gap between the amount of needs and the funding that's available.
Oh, so, what is regionalization and how can it help these smaller systems?
So, regionalization is a strategy that is used in some places, has been successful in some places, where adjacent systems collaborate or consolidate to reduce costs and increase efficiency. So, this can be particularly useful for small systems that don't really have the economies of scale. Like if I'm serving 300 people in my system, it will still cost me millions to build a new system, and it also costs NAMPA millions to build a new system. So, we have these small systems have fewer users to spread the financing costs across. And so, if they can be consolidated, sort of neighbors sharing a system, that is what regionalization is, and that can work. But it also really depends on a lot of factors, including whether there's another system nearby that they could collaborate with. And we are a rural state. We have sort of complex geography. And so regionalization may or may not be the answer for systems facing these challenges, depending on where they are and what their circumstances are.
So, we talked about growth in the beginning of the conversation, and I'd like to come back to that for a moment because you projected growth between 2025 to 2032. And you looked at like which regions will likely grow faster and have a greater need of more drinking water and wastewater capacity. So, what are those regions that you're looking at?
So we actually use the Department of Labor's growth projections, and they released new population projections for 2020 through 2034 as of
Hmm.
a month or so ago, and we're expecting to reach 2.4 million. It's pretty difficult to know where those people are going to go and what the status of the wastewater and drinking water systems in those projected locations are. So I won't necessarily comment on that, but we are expecting more people to come into the state. And so this problem isn't going to go away unless we address it.
So, what do you want people to take away from this report? Like the average person who maybe reads it, or even someone who's listening today, what really is that main key piece of information that you think is vital for the average person?
So I think our goal here is really to put information out there for people whose systems might be facing challenges, or to put it on the radar that this isn't something that sort of happens magically without a lot of investment by local officials, local government, system managers, and ultimately these financing mechanisms that may or may not still exist for these systems. Um, Individual users who are depending on these systems might experience increases in their rates and or disruptions in service. And this, we hope, will help them understand what's behind all of this, and perhaps get some information into the conversation as they try to figure out how to solve these problems.
Well, I want to thank you for taking time to speak with us about this today. We've been talking with Liz Bajent. She is the lead author of the new report, which is titled Idaho at a Glance: Wastewater and Drinking Water Systems in Idaho, from the James A. and Louise McClure Center for Public Policy Research at the University of Idaho. I'm Gemma Gaudette, and this is Idaho Matters.